Welcome to Dr. J's Prescription for Health. I'm your host, Dr. Malia Jensen. I'm board-certified family physician, been in practice for about 28 years. I'm located in Iowa. This is Tucker. He is my co-host. He's co-hosting from heaven. So everybody say hi to Tucker. He will know, trust me. I talk about him all the time. His ears are probably burning. Even the one that kind of sits down all the time. I don't know if he's... Yeah, you can see it. It's his right ear. But yeah, my little baby boy, my soul boy. All right, so we're waiting for everybody to join in here. We are live on YouTube and Instagram. So let me know, where are you listening from? What city, what state, what country? Where are you located? I'm always interested to see where you guys are listening from. I'm located in Iowa, I said that. So family practice, 28 years. It's been a joy. And now what I do is I close my physical practice and I do online consultations only now. And it's been a joy, and I've met so many very, very kind people. And I want to thank each and every one of you who are listening right now who has been a client of mine. Beverly is listening from New York City. Nice. I've been there a few times. I used to love to go at Christmas time, right before Christmas time. And there would be continuing medical education going on. My favorite hotel to stay at was the Grand Hyatt. I don't know why, but it just felt like home. And every single time I would go there, that's where I would stay. Loved it. I know there's tons of other hotels to stay at. I believe I stayed at one at Rockefeller Plaza one time, but I always went back to Grand Hyatt. It was wonderful time. I have wonderful memories. Pensfu is from Connecticut. Hello. Sula says, Sula is starting right out with the, we'd love to welcome you back. I know I should probably go. I have not. It's been years. Years. Okay. But yeah, I really should get back there once and just see the sights. I do really enjoy the Christmas time. Oh, that's okay, Sula. Sula says, sorry to jump in with a question. And we'll answer the question, then we'll maybe get started on a little mini lecture here and maybe get you guys to start thinking and ask questions again. Sula asks, hi, should we just eat when we are hungry and what we crave rather than strict diet plans? Well, I think that's a loaded question. Yes, I think we should eat when we're hungry. I believe that people who eat a crapola diet, that's a Dr. J word, crapola. When we eat a crapola diet, we're always hungry. So to say that we should eat when we're hungry, if you're eating a crapola diet, you're always hungry. So that would mean that you're always eating. I think when we, as a human population, overeat, we eat too much, we cause a lot of inflammation in our body. And I guess it just depends, Sula, on what your particular diet regimen is. I don't think that eating a proper human diet, according to Dr. Ken Berry, is a strict diet plan. That is what people should be eating. Julia, thank you for the gift. I appreciate it. Julia just gave me a goat trophy, and I do appreciate that. I appreciate you guys when you give super stickers and super chats. It helps me to survive. Yes, I do consultations, but just these little things allows me to know that you are finding value in these weekend live streams, Saturdays at 9 a.m. Central and Sunday at 10 a.m. Central. So for all of you guys right now on YouTube, can you hit the thumbs up? Let's try to get to 15. We're at 3. Everybody hit that thumbs up. Sula says, I gave up breakfast a long time ago, but now I eat breakfast again and try to keep nutrition a factor rather than empty food. I love that. And thank you for the gold coin. I appreciate that. Let's see. I mean, I know a lot. Yeah, I see that. Okay. I know a lot of people who will skip breakfast. They do a 16-8 fast. And it's not really skipping breakfast. They might eat at 6 o'clock as their last meal, before dark, so they're eating while it's still light out, and they might not eat again until 10, 11, 12 the next day. So that's, thank you, Sula, for the gift. I appreciate it. All right. Make sure I didn't miss any comments over here in regards to the diet. All right. So today, I thought I would capitalize on a reel that I did yesterday on dental health and heart disease and how the two connect. I remember years ago that my dentist told me that keeping your teeth clean helps to prevent heart disease. Now, in a way, in a roundabout way, I knew that, hey, if we keep our teeth clean, the bacteria isn't going to go to our heart and cause a problem. And I think that is something that the dentists maybe are, from what I've heard from you guys, that your dentists aren't talking about it. Okay. I think they truly believe it. And where is the disconnect between the dentist and your doctor? Why aren't these people talking to each other? That always amazes me. But then again, the cardiologist doesn't talk to the family practice. The surgeons don't talk to family practice. Nobody, no doctors talk. Their EHRs are not connected. We still use a fax machine. We use a fax machine when our patients, if you're family practice and we refer to cardiology or refer to rheumatology or pulmonology, we have correspondence back and forth via fax still. So they fax their note to us and then we scan that into their chart. Our EHR, electronic health records, are not connected. There are some groups in the Des Moines area that use the same, EHR, and that does help. But again, you know, myself, I was an independent practitioner, and those EHRs that they use are very, very, very cumbersome and very expensive to maintain. Okay. All right. So the dental health. In our mouth, we have bacteria, and those bacteria can cause tartar. Okay. The initial part is these bacteria make a biofilm on our teeth. They have a shield of protection, these bacteria. They make this biofilm, and then that biofilm is basically just soft types of bacteria. When they form a plaque on your teeth, that is basically an organized colony of these bacteria. The tartar is basically the end result of these bacteria forming a biofilm. And that biofilm is a shield of protection, and it's negatively charged, and it will attract positively charged ions, calcium, phosphate, and that's how that tartar builds up, and your dentist or dental hygienist has to go in and chisel it away. Now, those oral bacteria can get loose from your mouth, and they travel in your bloodstream, and they can go to your heart. They can go to your coronary arteries. They can go to your heart valves. Many of you who commented on yesterday's reel said that you had either aortic valve disease or some other mitral valve disease where you had vegetation starting, they call it vegetation, bacterial growth on the valves, and then that hardens, okay? Now, nowhere is there a mention of LDL hardening on the valves. No, they call it vegetation. That vegetation can be from your teeth. It's from chronic infections. But oral bacteria is one of the main causes of heart disease. We've known it for years. But there are some doctors out there and researchers like Dr. Jari Karhunen, a pathologist, studied endarterectomy specimens. Endarterectomy is a carotid endarterectomy. So you you have a finding of carotid artery disease. And they did an ultrasound. They found out that you have greater than 49% narrowing, probably 60% narrowing. And they go, we better do something. So they go in and do an endarterectomy, and they peel out that calcified lining of the arteries. And then pathologists like Dr. Karhunen will look at that specimen under the microscope, and they are finding that these biofilms, these plaques, share the exact same pathology of your oral bacteria. So they're finding, like Dr. Karhunen is finding the same bacteria in a carotid endarterectomy as they are finding in your mouth. So when you brush your teeth or you suffer from gum disease, oral microbes enter into the bloodstream and they seed themselves. Okay? Now, where do they seed themselves? They seed themselves in a soft plaque. Where does the soft plaque come from? An injury to the lining of the artery. Could that be from heavy metals, microplastics, nanoplastics, sugar, insulin, smoking, alcohol, all of those things that can cause an injury to the lining of the arterial wall. And then a plaque, a clot forms, basically a wound, a scab to heal that. Well, this is where these bacteria can nest. They will nest in the soft plaque. Now, we've learned that soft plaque turns to hard plaque just magically out of the blue. It turns to hard plaque. But there are doctors like Dr. Paul Mason and Dr. Karhunen that would tell you, hey, I just don't think that the soft plaque just hardens magically. Okay? What is actually hardening, according to researchers, is that when these bacteria from our mouth or any chronic infection seed themselves in this soft plaque, they secrete or build up a biofilm that shields them from our immune system. You might not even have symptoms, okay, of these bacteria. And this biofilm is electrically charged, and it's charged negative. So a negative charge is going to attract a positive charge. Calcium and phosphate are positively charged. So that bacterial biofilm is electrically charged, attracting positively charged ions that calcify the biofilm, not the soft plaque, but the biofilm that's inside that soft plaque. So think about this. Modern cardiology would tell you that having a calcified plaque is a good thing, meaning it's stable, okay? Camp 1 says if we calcify, it's a good thing, and the body stabilized the dangerous soft plaque. But is that true? Because the soft plaque stays soft, according to these researchers in Camp 2, that the soft plaque's not changing. It's the biofilm inside the soft plaque that's hardening. Camp 2 says because the soft plaque still surrounds that hardened biofilm, that the plaque, soft plaque, still remains volatile, very vulnerable, and a trigger like, I'm just going to name a few. It could be another infection. It could be stress. It could be anything. It could be shoveling snow in the winter and you've not done anything. Any type of stress could trigger those dormant bacteria that are just basically hibernating, hiding out in that soft plaque to suddenly wake up, disperse, release enzymes, bacteria release enzymes, and they can dissolve that soft plaque and that outer cap and cause it to rupture. What if, this is Camp 1 versus Camp 2. This is how much we don't know really what is going on. You got the LDL camp, and then you got the thrombogenic camp. So you got the lipid camp and you got the thrombogenic camp. And then you got people within the thrombogenic camp saying, hey, maybe calcified plaque is not stabilized at all. We're talking about, hardening LDL or hardening, another part of the wound of the scab, when really it's this biofilm. So I guess my main point of all of this, you guys, is, are we taking care of our teeth and our gums? I mean, what are your thoughts on doing mouthwashes? There's so many things. Regular chatter, I do not know how to decalcify your pineal gland. I have to punt on that one. I don't know. But it's interesting that we can open up our mind. Yes, I bet everybody knows that your teeth and gums, when they're in poor health, they can lead to heart disease. But did we really know the whole mechanism about the biofilm? I mean, this is called dystrophic calcification, if you want to look it up. Dr. Paul Mason talks about dystrophic, dystrophic calcification, okay? And I think it's big time on our doctors and our dentists getting together. I mean, what do the dentists know that the doctors don't know? Okay? And why are the dentists not talking about this anymore? The only reason I talked about it on my last visit was because the dental hygienist mentioned something, and I said, oh yeah, that tartar and heart disease connection, that's real. And what if we're doing a calcium score? Just what if we're doing that calcium score, and that calcium score is not really picking up hard LDL plaque. It's actually a measurement of chronic infection over time. That would be crazy. You're measuring the exoskeleton or the skeletons of bacterial and their biofilm. That's what we're really measuring. Now, am I saying that your mouth bacteria causes coronary artery disease? I am not. I can't, because there's not enough studies. But is there a correlation? Absolutely. So ask yourself, do you have tartar on your teeth that has to be chiseled off by your dental hygienist? And do you have a calcium score that's elevated? Because it could be that those same bacteria that are in your mouth releasing a biofilm and travel in our bloodstream and land and nest in our soft plaque, which most probably everybody has because there's some injury in your arteries, and they hide out there, nest and hide out. They build up a biofilm. That biofilm, good morning, Lucy. That biofilm, being electrically charged negative, attracts positively charged ions like calcium and phosphate, make something like hydroxyapatite, a hardened, calcified biofilm within the soft plaque. And any kind of a trigger to wake up those bacteria, because they're hibernating, right? They're nesting out. They're like hiding from the immune system. And any type of trigger, like you get sick, or you smoke cigars and then drink some alcohol, or you eat a big high sugary diet. I mean, anything could be a trigger to wake up these hibernating bacteria. They secrete an enzyme. That enzyme partially breaks down that soft plaque. It ruptures, and we get heart attacks and strokes. Well, what if? I know it sounds like a crazy explanation, but Journal of American Heart Association, they're starting to look into this. You can, pull up the JAHA. Ali says it's fluoride causing calcification of the pineal gland. Fluoride can be detoxified by iodine and boron. So, okay, Ali. So there are some schools of thought that say that your pineal gland, the calcification of your pineal gland, is from exposure to fluoride. Okay? fluoride in our water, fluoride in our toothpaste, fluoride everywhere, right? At the dentist office, they're giving fluoride treatments. And fluoride acts like an antibacterial. But fluoride has a strong attraction for iodine receptors on our cells. Every cell has iodine receptors. But our halides, fluoride, bromide, chloride, iodide, they all basically hit the same receptors. They're halides. Iodide has a lower affinity for these receptors and gets knocked off easily by something like fluoride that's in our body in high concentrations. So the reason that Ollie says give iodine is because if you give it in high enough concentrations, it will knock the fluoride off of the cell receptor and help for the iodine to attach. Now, how does that have anything to do with the calcification? Help me out here. Help me out with that mechanism of action, you guys. So Beverly says, so do you believe hydroxyapatite toothpaste is good? I love it and it keeps my teeth white. I think a fluoride-free toothpaste at this juncture is probably in our best interest. I mean, look at all the hypothyroidism that is coming up. Is hypothyroidism really because of low iodine, because of over fluoride in our body? It's possible, okay? It's possible. But we want to build up the enamel on our teeth. Our enamel is degrading. Once the enamel degrades, that's the hard coating on your teeth, we're into the dentin. And, a lot of people used to say, well, I'm just going to use some baking soda. Well, baking soda over time is so abrasive, it can destroy our enamel. And now you're into the dentin, and dentin looks gray. Your teeth will look gray because the enamel's gone and you can't whiten dentin, okay? And so we have to be very careful on what we use on our teeth. Our goal is to maintain the enamel. Okay, that's a good question. Megastar says, hi, are vitamin D tablets worth it? What amounts? I think you should have your vitamin D checked. I think you should get a stored vitamin D level and an active vitamin D level and see where you sit. Okay, not all stored vitamin D will go to active vitamin D. So we got to get both. And there should be a 2-to-1 to 1-to-1 ratio. Ivy Joy says, after heart cath, endarterectomy, and other thrombectomy procedures, hospitals are not investigating deep what kind of plaque or thrombus it was so that patient can understand and do prevention. I mean, that's a good point, okay? Our goal as a doctor or hospital, however you want to say it, is to follow standard of care. Our modern medicine does not go into investigating what caused your plaque. We want to give you the medicine that follows standard of care, that follows studies that was done by who knows who. And if you follow standard of care, then nobody gets in trouble. Now, that does a disservice to the patient because they don't even know what they're doing. I would venture to guess that most patients that come into the hospital for an MI or some sort of cardiovascular event have diabetes or prediabetes, which is hyperinsulinemia. And no doctor, if their A1C is less than 7, they're not going to do a deep dive into, hey, you got diabetes and maybe we should start working on that. But if they do find it, the thing is, let's just give you a medicine. Let's give you metformin or an SGLT2, or let's put you on a GLP-1 or some sort of combination of that. But I bet 75 to 80% of the MI patients will have diabetes. And now you think about it, if you have diabetes, you have sugar intoxication in your body. So what do bacteria love to eat? Do you not think that you're going to be growing bad bacteria in your mouth? It's all connected, guys. We need to connect these dots. But doctors don't look. You had coronary artery disease. Here's your beta blocker. Here's your blood thinner. Here's your statin. And I'll see, go to cardiac rehab and we'll see you in 3 months. And that's how the standard of care works. So it's you guys, unfortunately, you guys have the reins and you have to, look into things and educate yourself. It's unfortunate that you have to come to the internet, which I think is fortunate because that's what I do. I don't know all the answers. I don't know if this biofilm hardening, because of the electrically negatively charged attraction to positively charged ions like calcium and phosphate, do we know? I'm not sure, but I'm sure as heck looking into it, and I'm sure as heck going to check or to help you guys understand it, that there are other possibilities except for, oh, well, a stabilized plaque is good. Well, maybe it's not good. Okay, maybe that biofilm hardening and protecting itself is not a great thing. And if we get more and more bacterial buildup and then more and more plaque buildup, Dave Feldman, when he first started getting, you guys can look him up, but Dave Feldman, an engineer, says plaque begets plaque. You got some plaque, you're going to get more plaque, is what he is saying. But where did that plaque come from? Did it come from our mouth bacteria? Did it come from magically from the LDLs depositing themselves because of their sticky? Maybe it's a combination of both. Maybe you got all this bad bacteria from your mouth and other infections, and they all have biofilms. They all nest and wall themselves off with this biofilm that is making more plaque. And then maybe the sticky LDLs are landing on that plaque as well. And we just got a combination of the plaque that's being seen by pathologists like Dr. Karhunen. You're going to find some bacteria, biofilms like your mouth. You're going to find some LDL. You're going to find some platelets and some white blood cells and red blood cells. You're going to find all these things, right? So today's lecture, mini lecture, was simply about maybe we need to pay more attention to our gums and our teeth care, okay? And I remember Ruth had a question regarding why should we even floss or water pick, because you could be knocking off bacteria and causing it to go downstream or in through your bloodstream to your heart. I see where she has, where that's legit. However, I would tell Ruth, who I don't know if is listening today, that you need, I believe, regular checkups and deep cleaning. If you are a tartar former, you got to go more often. You got to go every 3 months and get deep cleaning, because that bacteria, if it's not being knocked off, it's starting the plaque formation and tartar formation, and those bacteria have a chance to go downstream to the heart. Okay. Some people are tartar formers, some people make cavities. It's usually not both. But when I look back, and I'm doing correlation here, I know correlation does not always equal causation, but when I think about my clients, my patients back in the day who had cardiovascular disease, had heart attacks or strokes, I remember their teeth were horrible teeth, plaque all over their teeth. They hadn't been to the dentist. Gums were red, probably bleeding. That is not a good sign when your gums bleed, okay? When you brush your teeth or you floss or I brought these up. These are made by gum. These actually go between your teeth and you can go back and forth. They have like a little, I don't know if you can see those little notches, you guys. They got little notches where they fit between your teeth. So say on your lower, if you're a tartar former, if you can stick that through there, go back and forth. It's like dental floss, but for some people, these might be a game changer, okay? And water picks. And I also I brought some demonstrations. So something like a water pick like this, okay? And you would start this after you get your teeth professionally clean, then start the water pick, then really go at it with, make sure you're flossing at least once a day, or using these gums, or doing both in that day, okay? Doing both, and keeping if you're a tartar former, because that bacteria could seed and go downstream and deposit or nest itself in injurious areas of your coronary arteries. So plan of action. Let's say you got a dentist appointment at the end of August, okay? You're gonna go for a professional cleaning, get deep cleaning, make sure you get the tartar out from underneath the gums, where the gums and the teeth meet. That's where bacteria love to seed themselves, okay? All of that gets clean. You're white as can be, and your teeth and your gums are healthy. Now is when you start the water pick, okay? Everyday water pick, and that will keep that bacteria from seeding itself in the gums, in the tissue, where it can develop a biofilm, and then, a plaque, and then it calcifies from remember, the biofilm is an electrically charged film, and it'll attract positive ions like calcium and potassium, okay? And that can increase or lead to tartar. I think most dentists would say, well, you know what, if you're not going to be here for a while, just go ahead and start the water pick. But then that kind of scares people. All right, so a good plan of action, let them clean it, suck all that out, don't be swallowing it. Most of them are really good about washing and doing it all at the same time, so they're keeping that bacterial free. If you have a pacemaker or a defibrillator, please take an antibiotic. I'm pretty sure that most dentists would want you to take like clindamycin or Keflex, or even amoxicillin prior to dental procedure, any dental, I think cleaning too. And a lot of dentists, they're pretty strongly opinionated when it comes to pacemakers and defibrillators, okay? So bacteria do not seed on those areas. Oh, thank you, Mark, for the gift. I appreciate it. Okay. Lucy asks, a friend got his CT and his carotid is 100% blocked, the other 50%. My in-law had the same and they did surgery on the 100% blocked. Why do some doctors do the surgery and others don't? Well, 50% blocked is maybe not an indication to do an endarterectomy. It's a dangerous procedure, you guys. When you're going under and you're messing around with blood flow, a 50% block, it might not warrant going in and doing, as long as there is blood flow to your brain. And they can do that by, looking at a carotid duplex and, like you said, a CT angiogram, or however they did it, I'm not sure, okay? But the 100% is 100%, okay? 1910 says, I know many dentists that recommend hydroxyapatite, and yes, baking soda and charcoal are too abrasive. Yeah, I mentioned it to my dentist, Sarah, and guess what? They go, yeah, I don't know if I believe in that. That seems a little too far-fetched that you can take a hydroxyapatite toothpaste and build up, help your enamel. I don't know if they're on it. Some believe it, some don't. And, all you can do is just bring it up or not bring it up and do your thing. Ali says EDTA can take care of calcium. I myself have noticed a lot of things that got stuck due to fluoride for years and have been slowly releasing due to high iodine intake. So how much iodine are you taking, Ali? Let us know. Let's see. Okay. Eve asks, does mouthwash help or harm? What do you guys think? When we do mouthwash and it has an antibacterial, it's going to kill off not only good bacteria, or bad bacteria, but also good bacteria. What do I mean by good bacteria? Bacteria in our mouth secrete something called nitric oxide. Nitric oxide is a vasodilator. It relaxes our arteries, even our coronary arteries, right? So if you kill off the bacteria that make nitric oxide, you are diminishing one area of, so the mouth bacteria make nitric oxide. That's just one area. Our lining of our arteries also make nitric oxide. So we kind of kill off one of the areas that make nitric oxide. So should we use an antibacterial? I mean, if you listen to Nathan Bryan, he will tell you that no, you should never use a mouthwash. What if it was not an antibacterial and it was simply just a cleaning? There are certain types of mouthwashes that are not antibacterial. I don't know right off the tip of my tongue what I would suggest to you, but again, I don't know. Do we have enough nitric oxide from the arterial lining? As long as the endothelial cells are healthy, they produce nitric oxide as well. So will we have enough? Could you take citrulline malate? And citrulline malate will convert through some stages to nitric oxide? Possibly. That would be possible. Would I take L-arginine? Probably not. I don't think the conversion of taking simply our body breaking down L-arginine, I'm not sure. I've done some reading. I think L-citrulline malate might be a better option if you're wanting to increase nitric oxide. If you want to go ahead and eat a whole bunch of beets and all that kind of stuff, go ahead. Those are foods that I keep out of my diet. So maybe the citrulline malate would be a better option for me. Okay. No, I don't disagree on Beverly. Hydroxyapatite will help to, can help to build up the enamel on our teeth. Should you not use a toothpaste at all? I mean, I know many people who just brush their teeth with water, but again, it's going to be I think I don't know enough that I could just say, this is exactly what I believe, because I'm kind of in limbo. I don't know what I believe, to be true enough where I could tell Beverly, shouldn't I be doing a hydroxyapatite toothpaste? If Dr. J chooses one, does that mean everybody should choose one? I just don't think so, okay? But again, I think just continuously learning how you can strengthen your teeth is in your best interest. Beverly says mouthwash harms. Yeah. Ruth, we were talking about you earlier. We're talking about teeth, and your question came up months and months ago in regard to flossing and brushing and releasing bacteria into the bloodstream. Sula says, enter between dental brushes on the wire. I'm not sure what you're talking about. Lucy says, I'm addicted to flossing. I eat and have to floss. My gums haven't bled in years. I think I formed some tartar on my bottom teeth. So you're a tartar former, Lucy. And, I mentioned this, and I don't know, that's weird, really weird. There are people who have told me that they are addicted to flossing because it feels good on their gums. They are addicted to the water pick because it feels good. There are people who have told me that they are addicted to going to the doctor because it's like massaging their gums, and when that is happening, it's actually increasing blood flow. So think about how the hormones in your bodies are being released when you relax. And if Lucy says, I'm so relaxed when I'm flossing my teeth, it makes my gums feel amazing. They love the massage. It increases blood flow and that. So Lucy's on a regimen where she's doing something on a regular basis. I happen to prefer these when Lucy is doing floss, I happen to use these. They're a little thicker. Dental floss seems to be a little thin. There's some that are tapes, and they are thicker and can hit and wrap around your teeth. You should form a C with your floss around each tooth on this side, on that side. And so forming a C and going back and forth will help to strip the biofilm away from your teeth so it doesn't start a plaque, which starts a tartar. Our mouth, the saliva glands, that's why you're getting it, I'm guessing, on the bottom teeth, you said, the saliva glands will release this fluid and the bacteria, and then that bacteria does cause the tartar, okay, over time. The more frequently we go to the dentist and have a dental hygienist, keeping that biofilm and plaque free so tartar doesn't build up. Some people are mouth breathers, and they will pool saliva in that area when they sleep. I had one listener tell me that they started taping their mouth shut, and they didn't have that problem of tartar buildup after that. So really good ideas. Lucy does ozone rinses instead of mouthwash. Okay. Nick, I think you should probably see your doctor in regards to your hemorrhoid problem. Marco asks, what is your take on oil pulling and xylitol? Xylitol in and of itself, a sugar alcohol, or it's a natural sugar, is an antibacterial. There are gums that people use. There's one called Pure, P-U-R, that has xylitol in it, that if you, maybe for 5 minutes, you chew on this gum, and the xylitol will help clean your teeth. Oil pulling, I go back and forth. You know, is it possible for coconut oil, for instance, to pull bacteria out of the gum line that's deep? I don't know, okay? In my heart of heart, I would think that oil pulling would actually increase tartar. But again, I'm just thinking in my head. I don't know that for a fact, okay? Sula says, I think mouthwash harms, better off with a tongue scraper, in my opinion. Lucy, the difference between citrulline malate and arginine is I think that we need to use a breakdown product like citrulline malate. I don't know the exact steps of breaking down L-arginine or citrulline to nitric oxide, but if you listen to Dr. Nathan Bryant and some others, they will tell you that our ability to break down L-arginine to nitric oxide is harder than it is to use citrulline malate in that pathway, okay? Again, I can't tell you what that pathway is exactly. You obviously can look it up, from L-arginine to nitric oxide, or citrulline malate into L-arginine into nitric oxide. Lucy uses Ollie. I can't remember what. I used to use Snow, but there's a lot of foaming agents like SLS, I think it's SLS, that are in these toothpaste. We need to be very careful about the chemicals. And now the one I have, it starts with an R, and I cannot remember the name. Okay, you love their toothpaste, but you did their mouth rinse and got blisters in your mouth. Yikes, that doesn't seem good. Burrs, we'll just say Burrs. I keep getting put off on my colonoscopy and keep finding out I need someone to stay with me at the hospital, not just a ride. Is that true? Some outpatient colonoscopy places are rigid. They have rigid rules, and they're like little, like hallway monitors, okay? And they're going around. If that person leaves, then, I mean, what are they going to do? Not let you go home? But yeah, you are required to bring somebody with you, drop you off. You cannot drive. And then they're supposed to stay, and the hall monitors are looking out for that. But, you know, what if they did leave and they came back? I'm pretty sure, Burrs, that you're going to be able to go home with them. But again, it's such a short procedure. The person is really only staying there for an hour, possibly, and then you get to go home. Just find somebody who's not working or has the day off and, you know, wants to sit and read and scroll on their phone. Find somebody like that, and then you won't have a problem. Okay? Right. You cannot, absolutely, one the run. You cannot have an Uber. They will, again, they do not like that. Sula says, I wonder how this affects people with veneers. They floss. Is that where the teeth have been filed down? Honestly, Sula, where we need to really watch this is at the gum line. Our gums are bad. Our gums are bad, okay? Gingivitis is a big risk factor for heart disease. Yes, Berzer, you will go under and they won't release you if no one is picking you up. I think they had a ride, Lucy, but the ride needs to stay there. Berzer says, I got my insurance company to take me and back, not an Uber. They said I have to have someone sit and stay with me in the hospital. I don't have anyone. Yeah, that sucks. I'm sorry. Lucy says, I never had to sit with my husband. Oh, so he did get that colonoscopy, huh, Lucy? And you just had to pick him up. Okay. Okay. Ollie says, eating a big amount of watermelon lowers their blood pressure because of the citrulline that's in the watermelon. Never knew that. But why is it lowering your blood pressure, right? So nitric oxide causes vasodilatation. Nitric oxide relaxes the arteries. That's why your blood pressure goes down. You knew that. I was just helping everybody else out. Eve says, is a colonoscopy really necessary? That's a good question. Is it really necessary? Is it just another gimmick that, you know, they require, or they recommend this at the age of 45 now, and you go get your colonoscopy, it's a procedure and they make big bucks? Or is it worth it? They find a polyp, they do a snare, get rid of it. A polyp is an early indication of colon cancer. But again, you know, here's my thoughts on it. If you're going to continue with a diet that encourages roughing up your lining of your colon, you are going to develop polyps, okay? And those polyps, yes, can turn to colon cancer. Not always. That's why they snare them and get rid of them. So, you know, maybe you get one, Eve. Maybe you get one colonoscopy. You see what's going on in there. Do you have diverticulosis? Do you have any polyps? Did you change your diet? What kind of a diet are you on? Are you on a high carb diet with a whole bunch of, you know, fiber and all of that? I don't know. Everybody is different. If you would want to, you know, do a consult, we can talk it over. But again, I think it has to be a decision that you make for yourself. Okay. Wisecracker is listening from Upper Peninsula, Michigan. Go Blue. I don't know. Are you a Spartan? Go Spartans. Are you a cowboy? Go Cowboys. Let's see. Maybe you can post online to ask. Oh, okay. Sarah's trying to help out. Okay. I got a gnat flying around here. I don't know if I got it or not. Ivy says, I decided not to have a mammogram again. I don't want a bulldozer pressing on my breasts and could cause trauma. Is it okay? I don't know. What did your last mammogram show? How old are you? Is there a family history? What's your diet? Are your breasts dense, fibrocystic? I mean, there's, I don't know if it's okay or not. Is it okay with you? Maybe you do a thermography next time. Maybe I didn't get it. Maybe you just do an ultrasound. If you have an outpatient facility that will just do an ultrasound, do that. They'll take your money. You don't need, the doctors won't okay that. I mean, like your family practice doctor. Some outpatient facilities will not do an ultrasound until you do a mammogram. I don't know if it's a money grab. I don't know. Okay. Lucy says, I am supposed to do a colon. Oh, okay. So I got you guys mixed up. So your husband had it years ago, and you're supposed to do one you haven't decided. Okay. I don't know what to tell you. Wisecrackers, mostly meat and eggs, some garden veggies, some cheat days, type 2 diabetic. Well, you're likely have more than some cheat days. You're having too much sugar. Type 2 diabetes is a disease of sugar intoxication, okay? Sugar intoxication. Yep, goal blood sugar is, fasting is 70 to 80. Oh, you're not into sports? Pops is a Packer guy. I meant the Western Michigan Cowboys, not the Dallas Cowboys. Okay. KB says, what are your thoughts on IV chelation therapy to help with spike protein from COVID and lead in blood, also autoimmune? I wish I knew the answer, KB. I struggle with chelation and whether it's safe or not. You know, there's a difference between chelation and sequestration. And I don't know. I think that we're coming up with all of these things. And again, I'm kind of a simplistic person, is I don't jump on all of these things. I don't know if there are spike proteins that can survive forever. I don't know. I don't know. We have been in the dark about so many things. We have no idea what's going on. We have people telling us about these spikes, and we have people telling us about all kinds of things that we poke into our bodies. And you guys, I'm not sure. Okay, I'm being honest with you. I am a minimalist, a simplistic person, and I kind of stay away from all of these things and just live and pray and exercise. The Keeson says, flossing healthy gums feel better than congested bums, but most people don't know the difference. Okay, thanks. Oh, that's a good idea. NLOTS doubles the floss so it's thicker. That's a good idea. So it doesn't get shredded and just kind of back and forth in between your teeth. KB says Dr. Peter Attia Adia had a great podcast on cardiac health this week. Thank you for sharing that with everybody. The Keeson says that veneers can cause additional buildup. Good to know. Thanks you guys for sharing all of this stuff. What about hydrogen peroxide? I think that hydrogen peroxide, again, we talked about baking soda for toothpaste. I think it feels great. I think maybe once a month, so 12 times a year for baking soda might be okay, but on a regular basis, baking soda is abrasive. It will destroy your enamel. And once that enamel is destroyed, then you are down to the dentin. And now we have a problem. Hydrogen peroxide, maybe a one-time deal, but over and over hydrogen peroxide, it decreases healing time. It actually has an enzyme that will block healing time. So no, I'm not a big believer of hydrogen peroxide. The stylist, is carbonation bad for your teeth? I don't know. That's a good question. Okay. Ruth says colonoscopy risk isn't always worth it. I mean, that's everybody. You need to weigh all of the pros and cons. I mean, what if they go in and you have a weak bowel wall, you've been on prednisone for years, and they poke a hole? Okay, I'm sure it's happened. Yep, thank you, Lucy. If you're interested in a consultation, please email me at ironladydoc@aol.com, ironladydoc@aol.com. Berzer says, have a blessed day. Thank you for your time. You're very welcome. Thanks for being here, you guys. Hit the thumbs up if you're there. Look and see if you're subscribed. If this information I give on weekends or my reels, if it resonates with you, make sure that you're subscribed so you don't miss anything. So you don't miss all of my information. Yeah, Allison, that's a good point. And the new mRNA flu vaccine that just came out, it makes you wonder, okay? It makes you wonder what is going on. I don't know. Yeah, it makes you roll your eyes. I see that. Ruth asks, I wish I could find floss that fits between my teeth. There are some, Ruth, that are very, very thin for tight teeth. So, okay. Rose asks, what do you think about MNM? MNM. Rose, I don't know. What does that stand for? Help me out. Okay. Ali says systemic enzymes take care of spikes and can clear arteries as well. Which enzymes? Ali, let us know. Sula says that, Ruth, Sula says that tape is better for your teeth, or tight teeth. So maybe give that a try. Unprecedented, that might be the way to go, okay? That might be the way to go. Just stay away. Sula says the program has been set back, as in with MMR for kids to the Rona vaccine. I don't understand what you're trying to say. Therese says, I've listened to you for 4 minutes and just subscribed. I like your thinking. Thank you. Can you share me? Share me with somebody who might not know me, okay? That would help. Rose says, so MNM, Mary, Nancy, Mary, is systemic, is wobezyme enzymes. Rose, you stumped me. You stumped me. And I hope that I can figure out more information, or Rose, you can send me a link. You've done that before, so maybe send me a link and I can educate myself. Thank you, guys. This is a journey. We're all on this together, okay? We're all on this journey together. I don't know it all. You guys don't know it all. And together we're going to help each other get through this until Jesus comes and takes us home, okay? I don't know. Ali says nattokinase, serrapeptase, lumbrokinase. I even have found a study on lumbrokinase dissolving spike protein. Really? I would love to see that one. Ali, if you could email me and just that link, ironladydoc@aol.com. I have not read that one. Lucy says a precursor to NAD. What is a precursor to NAD? Sula, I think that, parents have, I guess they have a right. I don't know. I think they have a right to do a medical release that they don't have to give their kids any pokes. There could be religious exemptions. There could be all kinds of exemptions. So they just have to look into it usually on their state government website in what is legal or not. Susan says, sweet Jesus, I agree. I so agree. Okay. That is true, Ali, or unprecedented. I haven't gotten into it deep. I mean, this was actually just the FDA. We just talked about this on Tuesday. Okay, so this is all new with that new flu vaccine, okay? Lucy. Lucy's helping me out, Rose. Lucy says NMN, Nancy, Mary, Nancy, all capitals. Nicotinamide mononucleotide can raise NAD. So it's raising antioxidants. And thank you, Leslie, for donating $5.60 to Rescue Rehab and Rehome. For every month, I try to raise $100 for Rescue Rehab and Rehome. That's where I got Little Buddy and where I got Tallow. So I appreciate you guys. It's a live fundraiser over on Instagram. If you guys on YouTube want that link, I can send it to you. But it helps all these little doggies that are on death row. They're in kill shelters, and Rescue Rehab and Rehome helps to save these dogs and find them homes. They're usually from other states, and like Oklahoma, where in Norman, where I got Norman Tallow, and that's also where a transplant where Buddy came from is Norman, Oklahoma. Yeah, Beverly, there are attorneys who can help you get exemptions for those pokes for your kids. Like, is it Dr. Reintz? I can't remember. Thank you, Leslie. I appreciate that. You're very kind. Okay. So you have heaps of studies that you're going to send me? Sounds good. Oh, don't send me too much. Yeah, it is real. I have an apparel link where you can order Dr. J apparel. There's an Ignorosis line of apparel. I think Leslie just recently got one and she sent me a picture. So they look cool. So if you want to, help support the Dr. J apparel, and yeah, that's a link. So that one's real. And I also put the live fundraiser for Rescue Rehab and Rehome. Thank you, Allison. Allison just donated $10.70 to my fundraiser for Rescue Rehab and Rehome. The guys were just at the house, I don't know if they're the actual founders, but they were at my house to do some nail trimming. So I talked to them and I just make sure I go, you're getting these donations every month. Oh yeah, we're getting them. They come through Meta. So I really they appreciate it. They've commented, they say, your listeners are really very kind to help support us. They don't even know us. And we're in Iowa, and I told them that I don't have very many listeners from Iowa. And from all of these other states, people are giving money to a little town in Iowa to support a very small Rescue Rehab Rehome. It is not large. They're all volunteers. There is no physical location of a rescue. It's in people's homes. They foster them, and they have a website, and they tell the story of the dog, and they're saving dogs. Now, yeah, we probably should be doing that more often. I want you guys to rescue. Of course I want you to rescue. Do I have 2 dogs that Timber came from a breeder. I'm not going to lie. I did not know as much as I know now. And Timber is AKC. Dad's a champion, and he's pretty amazing. But my others, they're amazing little rescues. I will always rescue. I'm pretty sure moving forward, I will always rescue. So again, KB, there is a little link. It says live fundraiser for rescue, rehab, rehome, and it says view, and you can click that and you can donate. It'll donate right to them in their name anyway. Okay. So they are getting it. They are getting the donations. They get them once a month. And I try to raise $100. I think if every one of the volunteers or did this, I think we would probably get rescue, rehab, and rehome on the map. But then again, I want it to be right. Okay. I want it to be right. I want just the right person. I don't want these dogs just to be given away, and the cats for that matter. There's a lot of cats. Oh my gosh. 1910 is out there in the sun at 8 a.m. It's 8 a.m. in Oregon. Been learning more about long wavelength light on mitochondrial glucose. Yeah, it's God's perfect design, isn't it? I agree. So yeah, I always remember it as Roy G. Biv. Thank you for the donation. I know it's in European. I have no idea what European $5 is, but thank you anyway. It doesn't matter if it's 50 cents or not. I appreciate everything you guys give, okay? It means a lot. Lucy's also finishing her walk, 50 minutes so far. Awesome. Yeah, thank you, Sula. Oh, from Ireland. Nice. Yeah, that is Ireland to Iowa. You're exactly right. Thank you. I appreciate that. All right. Any other questions? Where are we at with you guys? How do you feel about, now that I brought up this biofilm, and it's the biofilm from the bacteria that's hardening and not the actual LDL cholesterol in that soft plaque. How do you guys feel about that? How do you feel about modern medicine tell you that a stabilized plaque is best? I mean, that is camp one that says, hey, the calcification of your soft plaque is a good sign. It says your body has stabilized it and it's no longer dangerous. Okay, you don't have this dangerous soft plaque that can break off and rupture. You got a hard plaque. And then add to that, Dave Feldman says, plaque begets plaque. So you get this plaque, you get more plaque, on and on and on. Camp 2 says, hey, the soft plaque is still actually staying soft around the hard plaque. If Camp 2 says it's the biofilm produced by the bacteria that's hardening, then that soft plaque is still there. It's an illusion. The soft plaque is still there. The hard plaque is actually hard exoskeletons, the skeletons of the bacteria that's hardening, the biofilm, what they secrete. That part's hardening. Soft plaque stays. Then you get a trigger like infection or stress. And now you wake up those bacteria inside that, protected by that biofilm. You wake them up and suddenly they disperse and release enzymes that dissolve that soft plaque, cause a rupture. Do you believe it? Is it a good theory? I mean, do you want to look into it? And this is something that I'm going to start following Paul Mason, because this is newer information that's coming out from him. And I think he's amazing. I think Dr. Paul Mason he's got a brilliant mind. And I really like this Dr. Karhunen. She's a pathologist. I think it's a she. We'll say she is a pathologist looking at the correlation or the coincidence or the association of the bacteria that's in the carotid artery plaque, the same as the ones in the oral mouth. I mean, what do dentists know that they haven't been telling us, and why aren't doctors and dentists talking to each other? Yeah, Susan, I don't know what that would be, but you could be in the middle of the night grinding against your cheek and tearing off skin, and then you're continuously peeling that off. Maybe you need to get a mouth guard for at night. I agree, Sula. Anything is possible. Great theories, right? Anything is possible. We don't know all the answers. Yes, Dr. Paul Mason, exactly. Yep. Australia, maybe? UK? I can't remember. Lisa says, it's very confusing. I've been reading up on soft plaque and hard plaque. A calcium score was 12.7, and they found elevated LP little a. I'm trying to figure it all out. And this is why we're on this journey, Lisa. LP little a, in and up, we all have LP little a, all of us. If we didn't, we'd probably bleed to death. But God did not make a mistake by making LP little a. LP little a mimics plasminogen. LP little a acts like a former of blood clots, forms blood clots. LP little a finds an injury. If there is an injury, LP little a is a sticky type lipoprotein that has an ApoA protein and an ApoB protein. It's a combination. All LDL particles have an ApoB, but an LP little a has an ApoB and an ApoA. LP little a in high amounts means if there's an injury, you're going to make a blood clot, right? And then that blood clot is supposed to heal and dissolve through fibrinolysis. Fibrinolysis. Lysis means breaking down fibrin. That's why many of you guys are taking nattokinase and lumbrokinase, because they break down fibrin. Do we all just have fibrin around in our body? Yes. If there's an injury, you want to make a blood clot. You just don't want it to hang out there and continuously injure. So we have a mechanism that clots and a mechanism that once it heals, it breaks it down. If that teeter-totter is out of balance, then like the clot formation is going to accelerate. Our goal is to keep arterial injuries to a minimum, if at all. Stop smoking, stop drinking, stop sugar, stop insulin, stop microplastics and nanoplastics, stop diesel fumes, stop being around fires and smoke. All of these things can cause an injury. If it's just a one-time deal, I went to a party and they had a bonfire, that's a one-time deal. But it is possible that just that one trigger could throw you into a heart attack. What if you're a person who is got anger issues? Just increasing anger can cause a blood clot to form. Many blood clots to form. Has nothing to do with LP little a. But yet they, whoever it is, got us to link this LP little a with a doomsday. You got LP little a, if you don't take this medication, which they are coming out with, then you're done for. You're going to have a heart attack just because you're LP little a. And then they also did the same thing with ApoB. ApoB, okay? ApoB is, I just said, is on every LDL. If you believe all LDLs are bad, then I might as well just say doomsday and your ApoB is going to be high. But what if you have good LDLs and you have bad LDLs? What if that's the case? What if your good LDLs are really, really high? That's going to raise ApoB. What if your very low density LDLs are very, very high? That's not a good thing, okay? If you have high VLDLs, you have high triglycerides. If you have high triglycerides, you have high risk for coronary artery disease. High triglycerides means low HDL, okay? And there's a lot in between, Lisa. And this is what I do. I help you walk through all of your labs, and we determine what is really a risk factor and what is really not a risk factor. But a calcium score of 12.7, I don't know how old you are, okay? I don't know how long ago that was 12.7. Have you gotten an updated calcium score to follow progression? Maybe it's 12.7 now, and then in 2 years, it's still 12.7. And that is a good thing. Then I would say that your plaque is stable. Could you still have soft plaque? Yeah. How are your teeth? I don't know. All of these things add up. All of these things. Okay. Okay. You guys are kind of chit-chatting back and forth. I've never heard of candy floss, but isn't that a shame, Sula? That is a shame. Okay. Looking for questions. You guys have a lot of comments in here. If you have a question, please put a question mark so I know. Okay. Hopefully I answered Lisa's question. Yeah, put a QQ. Thanks, Lucy. So I can pick them out. Rose says, there are chiropractors who give homeopathic vaccines which are not toxic and sign papers that schools accept. Nice. So that's another option, you guys, for a letter. I've never heard of a chiropractor giving any kind of vaccine, homeopathic or deeply ones. I haven't either, Nello. But I don't even know what that looks like. Rose says, you do a fantastic job analyzing blood work and lipids. You are very wise and knowledgeable, Doc. Thank you. Thank you, Rose, for the kind words. I appreciate that. Yep, Lisa says, very informative. Thank you. Very welcome. Okay. Nello says, what do you think of a free for a very high, what do I think of a free for a very high LP little a of 320? Is that 320 American? You have a negative sign. I'm not sure. Nello, I don't understand your question. Oh, I meant aphrodisiac. No, I still don't understand your question. Okay, put it all together and ask the question. Okay. Yeah, put it all together so I know what you're saying. All right, where else you guys at? What other questions do you have? What other thoughts? What other LDL thoughts do you have? Now's your time. Right? Now's your chance. Ask. Your LDL is high. You've been told to take a statin. That's standard of care. Beverly says, I'm somewhat new to you, assuming you don't recommend stains. I'm guessing you meant statins. Well, I think that you have to ask yourself, what do statins do? Statins are HMG-CoA reductase inhibitors. They inhibit HMG-CoA. HMG-CoA is an enzyme that breaks down into the end product of cholesterol. And along the way, it makes vitamin K, it makes CoQ10, it makes vitamin D, which is a hormone. It makes your sex hormones, testosterone and estrogen. Without cholesterol, you aren't able to make all of these things, okay? This pathway where HMG goes down is called the mevalonate pathway. And that pathway is where we produce the CoQ10 and the vitamin D and the vitamin K and cholesterol. If you block that or inhibit HMG-CoA reductase, that means you're not going to get cholesterol, right? And when you take a statin, you're like telling yourself, oh, I guess I don't need cholesterol. Well, you've been told that cholesterol is the cause of coronary artery disease. But then today you just learned about maybe it's the biofilm from the oral bacteria that get into the bloodstream, seed itself into the soft plaque, produce a biofilm, and then hardens, and then that breaks off at a timely event, and you get a heart attack and stroke. Go lay down. Tootsie is talking. What is the positive of a statin? What is the positive of a statin? A positive is it is supposedly anti-inflammatory. It's also supposedly an anti-thrombotic. Now, many of you tell me, I don't care if it breaks down clots. I'm not taking it. I'd rather take lumbrokinase or nattokinase or an aspirin before I would take a statin because they want to keep their mind. their brain, because they need a myelin sheath around the nerves. Well, myelin sheaths is made of cholesterol. If you damage your production of cholesterol, then you can't form the fatty layer around your nerve, which is the wiring, your wiring system, your electrical system. We're so worried about the plumbing system, and now we won't have the components to protect the electrical system. It's a crazy thing. So you have to ask yourself, why are you even taking a statin? What is the reason? What's your diagnosis? Do you have an LDL receptor problem on the liver? Do you have a PCSK9 receptor problem? Do you have an NPC1L1 problem? There are so many reasons why your cholesterol could be elevated, none of which require a statin. What if your thyroid is off? Did you check your thyroid function? Why would you just say, I got high cholesterol, here's your statin, you didn't look at your thyroid? Well, your thyroid is hypothyroid. Well, doesn't that raise raise LDL? Of course it does. Are we looking? Are you menopausal? Does that raise LDL? Yes. Does saturated fat raise LDL? Yes. Well, is that a problem or not a problem? I don't know. I got to look at your labs. Okay, there's so much. Original Mean Girl says, thank you so much for saying this. My doctor has been pushing a statin as a preventative. A preventative. Okay, just so you know, there's primary reduction of an event, and then there's secondary reduction of an event. Okay? Primary prevention means you have never had an event, a heart attack or stroke. So if you take a statin, if you took it for 10 years, how many days extra would you get of life? According to studies that many people, many doctors don't even know are out there. And the answer is about 5 to 7 days extra of life. In the meantime, taking a statin could cause dementia, diabetes, decrease your hormones, decrease your libido, decrease your interest in sex with your spouse, could lead to Parkinson's disease, MS, Alzheimer's, all of these things. Is it worth that risk? Do you even know your diagnosis? What is causing it? Or do you just take a pill? Many of you take a pill for every ill. I am not that doctor. I don't push pills for every ill. I want to know what it is we are actually treating. So when somebody says, what is your take on statins? I said, what is your diagnosis? High cholesterol. Why? Is it high cholesterol or high LDL? Or is it high VLDL? Is it high small dense LDLs? What is high? Well, I don't know. The doctor never told me. Then you got to look into it. Okay? Statins lower CoQ10. They do. They don't even allow it to be produced. If you take a statin, Ali says, if you take a statin, this has to be supplemented. It absolutely does. But Ali, did you know that if you're over a certain age, you can't even break down CoQ10 into the active form of ubiquinol? You need to take ubiquinol. I would say if you're over the age of 50 and you are on a statin, don't take CoQ10, take ubiquinol. Okay? Original Mean Girl was diagnosed with dysautonomia and type 2 diabetes. From the statin or what? Cody is right there. It says this sham about cholesterol is total bull crap. High cholesterol isn't the problem. It's all the crap in our food that keeps our body from processing cholesterol properly. Could be, right? If you're eating a bunch of carbohydrates and refined sugars and processed foods, you are going to be making a lot of small, dense LDLs. Small, dense LDLs can be oxidized. They can be damaged. It's like rusting going on in your body. Small, dense LDLs are susceptible to being taken up by the wrong part of your immune system and causing foam cells to develop. And those foam cells are in these plaques. Doctors, like pathologists like Dr. Karhunen are finding this out, okay? But we've been led to believe that LDL is the only concern. If we just lower LDL down to 0, you're never going to have a heart attack. Well, how is that working out for us? coronary artery disease or heart disease and strokes is the leading cause of death for the past 70 years, despite all of these medications, statins and CETP inhibitors and PCSK9 inhibitors and all of these things, all of these medicines. Yet heart disease is still the number one cause of death. I mean, go figure. So is Cody right? All this cholesterol stuff is a sham? You know, since Mr. Keys and faking a whole bunch of studies? Ask your doctor if they even know who this Mr. Keys is. And ask him about the 7 country studies or the 21 country study or the 6 country study. Ask him about Christopher Ramsden in 2016 came out with a meta-analysis saying that all of those studies previously, when all of this cholesterol stuff came out, that it's not true. All the information was faked. But we've been brainwashed with cognitive dissonance for so long, we don't even know when we've been duped. I call it bamboozled. We have been bamboozled by the buffoonery. Did I say that there is not a possibility that small, dense LDLs are a problem? I do, but it's like Cody says, it's from the crapola that you're putting in your body that's increasing our risk of all of these things. No doctors are saying, well, what does your diet look like? Well, I eat just what normal people eat. I eat burritos and ho-hos and I eat some fruit and a little bit of veggie, but we eat out a lot. We're so busy. We're always grabbing some pizza or we got to be fast because our kids are in sports and they're really going to be good. They're going to be professionals. Really, they're going to be professionals, and you're making them really big and strong and healthy with all of the crap food, the crapola that you're putting in their body. And then you wonder why kids are getting fatty liver disease and early onset diabetes. Well, they're athletes, they need food. That's not food. That's called fake food. By definition, food has to have some nutritional value. It has to have nutritional value. Fake food does not have nutritional value. Well, it fills me up. Then eat it, okay? Eat your fake food and go for it. I don't want to tell people what to eat, what not to eat, okay? Electron says, what is the relationship between cholesterol blood work numbers and CAC score? Great question. Does LDL, HDL, ApoB, triglycerides influence the CAC score? The CAC score is a measurement of calcified plaque. Then we go back, what is causing the calcified plaque? If there is any. Is it LDL? There are some people who have zero calcified plaque, yet their LDL is sky high. Their HDL is sky high. Their triglycerides are ultra low. ApoB is a measure of every LDL particle. LDL, IDL, VLDL, LP(a). Every one of those has an ApoB attached to it, a B protein attached to it. It's called a lipoprotein for a reason. Lipo, fat, protein, ApoB. All of them. HDL has ApoA1. That's its protein. So if they keep you bamboozled and tell you that you should lower ApoB when you have nice, fluffy, buoyant LDLs for your immune system and your hormone production and your brain function, I don't know if they know that. I don't know. You guys tell me your doctors don't know any of this stuff. They just say your ApoB is high, here's your medicine. Well, how high? Oh, it's 100, here's your medicine. Well, do you know what your diagnosis is? No, they just told me it was high. Okay, well, do they know the ramifications? I don't know. Did they tell you to take CoQ10 or ubiquinol? No. What about vitamin D? No. I just do that on my own. But you don't know why. What about your immune system? What about the myelin sheaths? You guys, I'm just bringing this up. I'm probably just as confused as you guys, but something in me is saying, whoa. It's like the BS meter just went off and you say, come on, really? We're going to narrow our whole life down to one particle, LDL, and now it's not just LDL, it's ApoB. So we're going to count up all of your LDLs, IDLs, VLDLs, and LP little a's and put it all in one big pot, it says nothing. ApoB just measures particles. It doesn't tell you anything about how bad or good they are. But your doctor is going to say, any ApoB is bad. Okay. I would say what's bad is if you have a high VLDL. If your VLDLs are high and that causes your ApoB to be high, I'm on board with you having a risk factor for coronary artery disease. That is going to be a problem. Okay. Henry says taking a statin for primary prevention is like taking chemo prior to getting cancer. So in other words, in order to prevent one event, if you take it as a preventative, a statin as a preventative, to prevent one event, you would have to treat 100 people for 10 years. 100 people for 10 years to prevent one event. Is it worth it to you when all of these other things? Now, is there probably a time and a place for a statin? I would have to think about it. There possibly is, but I would really have to think about it. If the person wants to remain on a crapola diet, I might say, hey, you know what? We better give this person an anti-inflammatory and an anti-thrombotic because they're in doomsday, right? They just want to continue to keep eating that fake food that they're eating. And you know what? Doctors, listen to this. If you go to the doctor and the doctor sees that you have a cholesterol or an LDL that's over 130, it is almost mandatory for them to tell you to take a statin. They will write that prescription whether you take it or not because their job depends on it. Their ability to remain without being sued depends on it. Okay? You're talking to a financial interest, not because they're getting kickbacks. Their financial interest is the insurance companies will pay them if they follow the rules. If they follow standard of care, they get paid. And they don't get deductions. I've had patients tell me that their nurse practitioner, their doctor says, I have to write this prescription for you. Please go pick it up so I can keep my job. Really? They're being honest with that patient. It's hard for me to even comprehend that we are at this place. Details asks, is lumbrokinase and nattokinase the same? I am taking nattokinase now. Nattokinase and lumbrokinase are not the same. Lumbrokinase is higher concentration. They come from two different things. One from natto is soy, a Japanese soy, and lumbrokinase comes from an earthworm. They are completely different different mechanisms as well. Lumbrokinase is highly concentrated. It will be more potent and it's not as active all the time in our bloodstream like nattokinase. Nattokinase is always active searching out fibrin. Lumbrokinase, it sees fibrin and bam, goes to work. Okay? There are certain times I would recommend lumbrokinase. And I know this sounds crazy, but I always ask the patient, what is your blood type? What is your blood type? If you are O positive, I'm going to say you probably do just fine with nattokinase. If you're O negative, I would say that you'll do just fine with nattokinase. But if you're blood type A or B or even AB, and if you're AB negative, I would say, you know what? I think lumbrokinase is a little more up your alley. Okay? So I do go a little bit by blood type. Nello says, great comments. I'm postmenopausal. Would some hormone help? Help with what? Now that they changed the protocol and took away the black box warning off of HRT. You mean so now more people can sell you bioavailable plant hormones that come from phytosterols and not from cholesterol? Do you see where I'm going with this? Are you going to put a plant sterol? Are you a plant? Those of you who take hormones. Are you, I don't know the answer, but Nillo, are you a plant or are you an animal? If you are an animal, how can you assimilate a plant sterol into your body and call it real? It's a plant sterol. Would you eat seed oils? I don't know the answer of whether or not you should take a hormone or not. I'm just saying, would you be best served by having your own body make its own hormones? Yeah, but I'm postmenopausal. Okay, so you say the ovary was the only place that makes your hormones? That would be not true. Your adrenal glands also increase production. They take over 80% of your hormone production after your ovaries shut down. Your adrenal glands. But if your adrenal glands are not healthy, do you think that the DHA will be produced that will convert to androstenedione? The androstenedione will convert to testosterone. The testosterone will convert to your estrogen? Likely not. If your adrenal glands are not healthy, then you might not get, and you say, you know what, I'm just going to take the plant sterols and whatever I can assimilate into my body, I'll take it. But what about the blood clot risk? What about all of these other things? God, I don't know, did God make a mistake? This is just the question. Did God make a mistake when he made it that women will go through menopause and then their ovaries will shut down? Did he make a mistake that man says, oh, God for sure made a mistake, and here's your hormones? Yeah, they make me feel good. Well, what's making you feel bad? What made you feel bad that you need to take something to make you feel good? How about taking away whatever made you feel bad first? I don't know. It goes back to my simplistic, what are your thoughts on Repatha? Asked Lisa. Repatha is a PCSK9 inhibitor. Do you have a problem with PCSK9? What is that? Well, PCSK9, when it's active in our body, it destroys LDL receptors on our liver. Was that good or bad? Well, if you don't have LDL receptors on your liver, you cannot take up all of the LDL in your bloodstream. LDL needs to go back home. It's made in the liver, it goes out into circulation, does all its job, and then it returns back home base. Home base is the liver. If the liver has no doors or windows for the LDL to come into, the LDL will stay in the bloodstream. PCSK9 destroys LDL receptors. Now, we probably need a little bit of LDL receptors to be recycled. So PCSK9 can't be all that bad because we all have it and God made it. But what if you have too much PCSK9 and you're destroying too many LDL receptors? Okay, then we're going to inhibit the PCSK9. So we'll take a Repatha, a PCSK9 inhibitor. I would ask, do you have an LDL receptor problem? And why? Do you have hypothyroidism? Are you eating too much saturated fat? Do you have menopause? Those are my thoughts on Repatha, Lisa. Great question. Do statins lower ApoB? Of course they do. Statins will lower the production of LDLs. It's not making any cholesterol. So where, there's no LDLs needed to carry any cholesterol. And apparently your cells don't need any cholesterol either. Beverly says, I have high cholesterol my whole life. My calcium score is 0, twice. She's 72. Her chances of having any problem with coronary calcification is pretty slim. Anne says, I have genetic cholesterol. I don't know what that means. Do you have genetic cholesterol? You've been tested. You have FH, Anne? Do you have heterozygous FH or homozygous FH? Is your FH related to your ApoB, your PCSK9, or the LDL receptor? Or all three? How does anyone tell you that, Anne, that you have a genetic cholesterol? and high LDL. Well, if you have cholesterol that's high, LDL is going to be high because LDL, HDL, IDL, VLDL, they all carry cholesterol. You were put on Crestor and Zetia. So Zetia treats NPC1L1 hyperabsorber in the gut problem. Is that what your diagnosis is? If you have NPC1L1 problem, you're a hyperabsorber. If you take Crestor, it'll make it worse. What is the diagnosis, Anne? Were you ever told? Did they look into it? These are the things that absolutely drive me crazy. Maybe, just maybe, Crestor and Zetia were the right things for her. Or maybe not. Do we know our diagnosis? And you know what? You guys listening, you're never going to know unless you educate you. Do you think that your doctor is going to sit home for 5 hours like me and read up on all this stuff so on weekends I can tell you all about it? Are you kidding me? No. Absolutely no. That I'm speculating, but I'm going to say a big fat no. All right? Where are my offices located? I actually closed my office in April 30th, 2025. I work from home. I only do consultations with you guys. I only review labs and lifestyle and your sleep and your diet and your exercise routine. I evaluate all of that. And I tell you, here's where your risks are. And I give you information so you can talk to your doctor. I'm not your doctor. I am a doctor. I'm a family practice physician, but I'm a coach. I'm coaching you. I'm teaching you how to read your labs. I'm teaching you all the nuances and not just looking at the reference range. The reference range means nothing. If you want to compare yourself with a bunch of sick people, look at the reference range. Oh, I'm good. Well, you're the good sick person instead of the bad sick person. There's a lot of nuances when you read your labs, and then you put into context how you live, how you sleep, what you eat, what your stress is. All of that matters. Okay, it all matters. Your doctors just see LDL 130, here's your medicine. But now I'm going to armor you with information that you can go read up on. Beverly says, if I met with you, so via consultation, can you order bloods? I can in certain states, most all states, but your insurance will not cover it. Do people use their HSA cards? They do. So if you got all of the blood that I would suggest that it would be great for you to have, it could be over $400, $450. That is going to come out of your pocket because I do not deal with insurance. And the lab that I use also does not deal with insurance. It is cash pay. Congratulations to them. They are out of the rat race, out of the matrix. So I just put in an order. I send it to you in an email. I will email you a cart of labs. You can decide to pay for it or not pay for it. You could remove some of the things. If you say, I don't need that, I'm going to save $20 here and $20 there. Okay, that is up to you. You have all the control. Your pocketbook has all the control. Rose says, Beverly, she is an amazing doc. Go for it. She has been changing my life. Thank you, Rose. Rose, you are a good student too, though. You're a very good student. Rose says, and Beverly, my concierge docs in Miami are learning from her. That's awesome. Thank you, Rose. Annie says, every statin I go on, eventually I get leg, foot, and ankle cramps. So her body's not making CoQ10, but you have to really dig deeper, Annie. I'm going to venture to guess that your liver is a weak link. I'm going to think that your AST is over 15, your ALT is over 15, your GGT is over 20, your ELK phos might even be over 100, maybe even 101. Your liver is the weak link. Okay? And if you give a statin that shuts down it even more, it's no wonder that every statin, even lipid or water-soluble statins, are causing a problem in you. Look to your liver, Annie. Your liver is a weak link. KB says Jim Otvas, PhD, talked at length about MVX score, don't know what it is, and glycate score. He started a lab called Liposcience and then sold to LabCorp. He really has some good info on LDL, LP little a, ApoB, also particle level. Great, thanks. Okay. Nello says, wow, never heard of lumbrokinase. Where can you purchase that? Amazon. Happy Saturday, guy. What is your opinion on taking beef organ supplement? I think if you're not going to eat organs, then yep, I would take a beef organ supplement. Do I think you need all 6 capsules? I don't know. I'd have to check your labs. But yeah, be cautious on what you're, but yeah, if you can't eat organs, I think organs are important. Okay? I do. There are some doctors out there, even the carnivore docs, who will say, hey, you know what? I don't need organs and you guys don't need them. It's just a bunch of hogwash. Maybe. But I've seen some negative consequences from not eating organs, even if it's just once a week. Okay? Marnie says, good point about the plant sterols. Yeah, I know, right? It's just something I think about. Nella says, I see your reasoning. I thought it would help with sleep. My hair is thinning and I have high LP little a of 320. There's some other things going on. Why is your hair thinning? It's you could be taking a plant sterol and actually it is incorporating itself and your testosterone is actually converting to DHT rather than to estrogen. DHT, dihydrotestosterone. If you have high dihydrotestosterone, you are going to have hair thinning and male pattern hair loss, as well as hair growth in areas where women aren't supposed to have or should not have. As we become menopausal, our testosterone does not convert to estrogen like it used to. It converts to DHT. So you need to make sure that you have a DHT blocker on board, okay? Make sure your hair is exfoliated on a regular basis because the sebum holds DHT. Okay? Okay. Sula says, I was never given a printout of my blood. I was just told it is low and was shown out due to time constraints for next patient. Very frustrating. Yeah, that would be very frustrating. Hoover says, I'm beginning to think whoever they is, right? We don't even know who they are. Do we really know who they are? We all say they because it's just this boogeyman of people. And it's not one man, it's not one woman, it's a whole bunch of satanic minions. They are lying to us about everything. Satan is the father of lie. He's the father of lies. He knows everything about Jesus. Everything. He believes in Jesus. You guys, even Satan believes in Jesus. Satan knows the Bible inside and out. And all of his little minions, yeah, they work for him. We call them they. I'm just going to give them the word they. That's who they are. Satanic little minions lying to us. Little minion father of lies. Yep, I agree, name. We are all going to die. All of us are going to die. And my goal is I'm going up, not down. So first and foremost, I want a relationship with Jesus. That is first and foremost. I don't care about LDL. It's Jesus. I don't care about diabetes. It's Jesus. But in the meantime, I have a temple that houses my Holy Spirit, Jesus. And so am I going to defile my holy temple? No. I'm going to treat it with the utmost care. Do I put fake food in it? No, I try not to. Is there going to be a time I have fake food? Absolutely. But I don't want to defile my temple on and on and on, chronic, develop diseases and do all of these things. That is not respectful to my Savior. And so I'm good. This is me personally. This is what he means to me. So I'm going to take care of this until the day he calls me home. Yeah, I'm going to take care of my car because that was a blessing to me. All right? If I die in a car accident, like you suggest, then God will take me home. I know where I'm going. I am good with where I'm going. Okay? I'm confident in where I'm going. All right? I don't believe in that stuff. You don't have to believe in anything. I want you to. I want you to go to heaven with me. I want you to meet Jesus. I want you to have a relationship. I want you to know that you are a sinner. Everyone is a sinner. And that we can't ever do good enough. Well, there's nothing that we could do that is good enough, or else we wouldn't have needed a savior. Okay. Yeah, I agree, Eve. She says, saying cholesterol is the cause of heart disease is akin to saying firefighters are the cause of fires because they're at the scene of the fire. I agree. LDL is a protective mechanism. It is a healer, like LP little a. They heal wounds. Now, are there bad particles that can lead to oxidation and destruction of our arteries? Yes, I do believe that. Okay. Cody says, I believe cholesterol meds and the lack of the ability to process cholesterol is why Alzheimer's has spiked. Your brain is mostly cholesterol and it needs it. And unfortunately, our body, our brain can make its own cholesterol. It has its own mevalonate pathway. That's why you never give a lipid soluble statin, like like atorvastatin, because it crosses the blood-brain barrier. So it's blocking the mevalonate pathway in your liver, and it's also blocking the mevalonate pathway in your brain. So is Crestor better than Lipitor or atorvastatin? Is rosuvastatin better than atorvastatin in that regard? Yeah, at least Crestor doesn't cross the blood-brain barrier. But all in all, you guys, if you're feeding your brain sugar, it's going to be starving to death. It is starving to death. That's why you have brain fog. Your brain would much rather have ketones. How do you get ketones? Low sugar level, low insulin level. Your body cannot make ketones in the presence of high insulin. Okay? Nope, Sula, they haven't fixed the food pyramid. That's why we need to Ansel Keys. Yeah, he's responsible for a lot of deaths due to his doctored studies. That's right. So if you read the meta-analysis that was done by Christopher Ramsden, Ramsden, I believe it was from 2016, read that. I think you'll be amazed at what his findings show. Let's see. Cody says, what happened to the doctors telling you you are fat and need to lose weight? Those doctors actually got reprimanded by the board of medicine. So if a person says that if your doctor called you fat and you should lose weight, well, they're telling you the truth. You have fat on your body and you need to lose weight. Those doctors do not exist because they've been reprimanded by the board of medicine, been fined and sent to a 2-day boundaries, what do they call it? Medical education, where you have to write a report on what you learned about not telling people that they're overweight and need to lose weight and that their diseases, chronic diseases, are caused by them having high insulin and leading to obesity. Yep, those doctors, Cody, do not exist. They've been reprimanded, okay? You cannot say those words. Alex says the problem with doctors focusing too much on fatness is that sometimes fat people have a health condition not related to their weight. What is that, Alex? Give me an example of a health condition not related to your weight. Okay? What is that? Just give me one condition and let's talk about it. Okay. Yeah, Alex, doctors are not just advertisers. They're actually pawns. They've been led astray. Doctors have been led astray, including myself. I was one of them. I didn't even, you could say, oh, Dr. Jensen, you have a brain. Yeah, I have a brain and was never used. I mimicked everything I heard. I repeated all of the recipe over and over and over again. And if it wasn't for my patients, like you guys listening who are, were way ahead of me, if it wasn't for those patients who made me listen to something or made me read something, they didn't make me do anything. I just chose to do it. But had they not brought it to my attention, I would not be where I'm at today. I would still be living in a matrix, I would be wanting to make money and follow the rules, follow the standard of care. You got this, here's this. You got that, here's that. We make a diagnosis, I pat myself on the back, I give you the medicine, and all is good. Insurance company pays me, and we're good. I don't have to worry about getting sued. I can build my house and have my car and send my kids to college and have a dog park and all of those things. And when I go home, I don't think about you, anyone. I just think about me and my family and my money and my things and my. I'm not saying that's we need to take ourselves into consideration. I get that. Okay. But it had nothing to do with you and your chronic diseases. Yeah. Pills and knives. Yeah. Cody, I really don't have an opinion on methylene blue. I don't know anything about it. Okay. I'm sure it's blue though. What does one do for psoriatic arthritis? Why do you have psoriatic arthritis? Is it your diet? Thank you, Heidi. I appreciate that. So find out what the cause of the psoriatic arthritis is. Is it your diet? Is it a medication? Is it something that you're doing? I don't know. And then I would, instead of doing something for psoriatic arthritis, I would remove whatever is causing psoriatic arthritis. What is increasing your immune system to fight against your skin? Something's going on with your immune system. And no, it's not genetic. Okay? Rose says, what is your best to decrease visceral fat? Stop carbs to lower blood sugar, to lower insulin. Insulin that's over 5, 6 is a growth for fat. It is pushing all of the energy into fat cells. When all of the peripheral fat cells are full, it's called ectopic fat. Fatty liver, fatty tongue, fatty pancreas, fatty kidney, fatty everything is a problem. Stop the carbs. Stop the carbs. Okay. I'm trying to read your questions, you guys. Beverly, can you get your labs checked in New York City? No. New York City, I believe, is New York, Rhode Island, New Jersey. Do not allow individuals to get their own labs, even if a doctor ordered them. They can't do them. It has to go through their primary care through insurance or not insurance. You'll be paying. So New York City is one of those cities or New York is one of those states. So a lot of my people who live in New York or New Jersey, they will go to Pennsylvania to have their blood drawn. So I order it. They pick a lab in Pennsylvania or wherever is close out of the state where there's an available. So they might travel 3 hours just to get their blood drawn. Crazy, right? How to get a consultation? Email me at ironladydoc, IRONLADYDOC at AOL.com, ironladydoc@AOL.com. Yes, I do script, but again, you're in New York. I believe that is one state I can't order in. JB says, how would you go about lowering AST at 38? Yikes, that is high. 15 is tops. What type of liver support would you do? I wouldn't do any liver support. I would take away what is causing your 38 AST. Are you on medications? Do you have fatty liver? I would get a GGT and an ELK phos. Thank you, Dean. I appreciate that. You guys, when you give the super stickers or super chats, it tells me that you find this information valuable, and it also helps this channel keep going. So JB, I would analyze your diet, and I would go from there. I would want to lower your risk of having fatty liver disease. Your liver is likely choked up. It's being strangled by fat. You likely have cholestasis where the bile is not flowing. Is the ducts the problem? Is the liver the problem? I would have to look, okay? Things could be backing up. Cholestasis. And good morning, JB. Annie says, what test should I have for my liver? I would do an AST, an ALT, a GGT, and an ELK phos. I would do a chem profile and a CBC. I would do them all. Annie, there's a lot of labs that I would probably do that I can give me an indication of what is going on in your liver. Guy is taking 3 organ capsules. I think 3 is fine. Just check, you got to check your iron studies and your B12 and your folate. Keep an eye on those because they can go sky high, okay? Not that it's a bad thing, but it could be. Yep, you're welcome, Nello, about the DHT. Okay. Karen says, I'm at the gym. Awesome. And this just popped up. Awesome. Here I am. Wow, will you be listing the suggested SUPs? I'm 56 and a bodybuilding woman. I'm told I have genetic LDL and I'm fighting the statins off. What genetic LDL problem do you have? Okay, that's, you guys, 56-year-old Karen, who's a fitness expert and into bodybuilding, is being told that she's genetically somehow got a problem and is never diagnosed. I'm guessing. What is the diagnosis? Did somebody get an FH panel? Did somebody check a cholesterol balance test? Yes or no? What is our diagnosis? 56-year-old fitness expert, don't just take the statins until you have a diagnosis. An expert diagnosis. What is the diagnosis? You're going to need new labs. Nella says, amen, I'm going up too. Good, Nella. You and I will have a lot of conversations. That's awesome. I love that. Nello says, I just lost my husband of 50 years. Wow, Nello. That's like all of your life, right? I know you're probably 70, but you guys meet when you're 20 and you're together for 50 years. It's amazing. How do you deal with grief? I have no experience in your loss, but I've lost a lot of things in my life that is probably equal. I want to downgrade your husband by any means, but in my mind, it could be as equal as you losing your husband. And I pray. I hang out with people who are positive influences on me, who understand me. That is very hard to find, is somebody who understands you and how you deal with grief. You got to go through all of the stages of Kubler-Ross, and studying Kubler-Ross might help. Elizabeth Kubler-Ross, just studying that and being one with God, being one with Jesus and saying, you got him. This was a positive thing. I'm alone, I'm lonely, and I'm scared, but I'm ready to go with you. But I need your help to keep going. Because you're here for a reason, or else you would have gone too, Nello. God would have taken you, but he's still working on you. He's using you as a conduit. And what kind of a conduit are you? Are you a conduit that's sitting on your couch and mourning? I'm not saying you hear me out. I'm not criticizing. I'm just saying God cannot use you as a conduit if you are not out there being a conduit. If nobody sees your salt and your light, you're really not doing anything that you were commissioned to do. It hurts. I know it hurts, but it is no way to shut down, and you don't need to take medicines to help you through that, or products or supplements, or nothing is wrong with you. This is natural. So get that out of your head. This is a natural process and it's normal. These are things. We are humans. We love deeply in most instances because Jesus loves. He was probably crying when he took your husband, thinking of you. Okay? Let's see. Yeah, I hear you on that one, Henry, about the medical establishment and, conformist. MDs, DOs, medical providers are conformists, whereas engineers are not. They're always trying to think through things like, hey, what if this? What if that? Big Ben says my liver likes A5 Wagyu beef, Wagyu steaks. Nice. Thanks, Susan. It's all in the eyes of the beholder. If you say I don't look good, great. That's awesome. Okay? That's awesome. If I look good, that's awesome too. Okay. All right. Lucy, where are we at here? Is Lucy still here? Maybe she took off. I don't know. JB says, is 38 AST high? Yes, it is. Your A1C is 5.4. What's your insulin level? What's your ALT? What's your ELK phos? What's your GGT? Should you take a glutathione support? No. Why would you take a glutathione support? Your body makes glutathione. Maybe your liver is not making glutathione. Why? Well, I don't have enough glycine. Take glycine. Eat foods with glycine. That's collagen, bone broth. You don't just take glutathione. So glutathione is a master antioxidant, right? Produced in the liver. Do you just go saying, you know what? I think God messed up and our body I just have to go take glutathione because I don't have enough. Well, how do you know you don't have enough? Well, that's got to be what my problem is with the liver. How do you know? Maybe if you unchoke it from the fat, your body can start making glutathione. I don't know. Okay? Thank you, Susan. I think probably Lucy had to exit because I'm getting a lot of riffraff over there on YouTube. Buckingham says, what is the best way to overcome insulin resistance? Decrease your insulin. How? Decrease your carbs. Beverly says, do you know about the medical medium? The book? He has great information available place else, and he espouses much of what I don't know anybody. There's a book called The Medical Medium, I think. Yes, JB, bamboozled by the buffoonery. Dr. J words, bamboozled by the buffoonery. You guys, if you want a list of labs, email me at ironladydoc@aol.com. Yeah, Susan, we can block the riffraff. I'm doing the best. Usually Lucy does that, but she probably had to go. Cholestasis. 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 Good job. Joy says genetic diabetes type 2. No such thing. No such thing. 2 hours exercise a day, metformin, high cholesterol. What labs do I need? Email me for a list of labs, you guys. ironladydoc@aol.com. There is no genetic type 2 diabetes unless you're eating exactly what your genetic family was eating. Whoever you were living with, you eat the same foods, you do the same things, then I guess you could call it genetic, but I would maybe say epigenetics. You had a gene and you fed it. Yep, you're right. Nello, he has absolutely no pain. He's in a new body with a new name. He's got it all going on up there. So I understand it is tough. Just keep him in your heart and your memory. Talk to him on a daily basis. It helps. You pray about it, and you continue to follow through with your commission. You've been commissioned to share the gospel. Ask yourself, are you sharing the gospel? Details, no, it is not the same, but if you listen back, you'll hear the difference. It just, there's a lot of dependings on that, a lot of variables. How do you unchoke the liver of fat? Lower the insulin down to 3 to 5. Your goal insulin level should be 3 to 5. 3 to 5. Cholestasis. You're closer before, JB. Okay. All right, you guys. That's it for the questions. I went through everything. A lot of comments on here, but for the questions, we're pretty much good. If you have a topic of interest for tomorrow, email me at ironladydoc@aol.com, and I will entertain that. I'm not going to promise that I'll do that topic, but let me know if there's something. I have not planned for tomorrow's live stream. It's at 10 a.m. Central. Sunday live stream's at 10 a.m. Saturday live stream is at 9 a.m. I want to thank you guys all for being here and for hitting the thumbs up, for the super chats and the super stickers, for donating to Rescue Rehab and Rehome, for buying Dr. J apparel and sharing me. And hopefully we can help others that are bamboozled by the buffoonery. All of that. I don't expect it. Or I don't pretend that I know everything. I'm on this journey with you. I want to journey with you and keep learning. We are not satisfied, you guys. We're not satisfied with just believing whatever we've been told, like we're robots. It's not like that. Our bodies are so intricate. There's so many things that God made us so perfect. Yet we are messing it up. We are messing it up with man's fake food, and we're messing it up with man's fake medicines, pretending like we need all of these things when we are actually doing it to ourselves. Okay? And it's sad how they're testing and you know, if you want to start talking about dogs being tested on, that riles me up, okay? They mean the world to me. God blessed me with dogs. Okay, the love that they have. And about the closest thing to agape love is a dog's love. Agape love is God. Okay, you guys. Lord willing, I will be back tomorrow at 10 a.m. Central on a Sunday. If you have a topic of interest, email me at ironladydoc@aol.com if you want labs. Again, if I'm getting a whole bunch of emails, you guys, please bear with me. I've got some people to get back to. Sending them invoices for the pre-reviews. It's hard. I want to do this all on my own, you guys. I don't want to hire a team. I am not a team. I guess I am. I got little teams. I got Buddy Blue and Tallow and Tootie and Timber. I got all of them. They're my little team. So please bear with me. If I don't answer back an email, it could be it went to spam and I didn't get it. Just email me again. It's not going to offend me and say, Dr. Jensen, I don't want to keep harping on you, but you didn't answer back. And I'm wondering, did you get my labs? Did you get my invoice? Did you, just email me. I'm one person trying to do it all and help you guys. I'm probably stretched too thin, but it's the way I want to do it because I spend an hour, 2 hours, 4 hours going over your stuff and making sure that I don't miss anything. And if I do miss something, we talk about it the next time. I have given, like Rose, I have given stuff to Rose, okay? We've talked about all of her history and all of these things, right? And we did a plan of action. And then she'll come back the next time and something else will have come up that gives me more information. I go, oh my gosh, hold on. Stop what we're doing. That was wrong. Or here's a better pathway. Or, oh my gosh, well, that connected another dot. It's a learning process. What I knew 3 months ago with Rose isn't what I know 3 months now. I know about biofilms and bacteria and electrical charges and a negative charge attracting a positive charge. And that's how the calcium and the phosphate hardened the plaque. I mean, seriously, this is good stuff, right, Rose? It's all good stuff. Rose isn't going to say, oh, Dr. Jensen, you should have known that. No. Rose goes, hey, this girl's still learning. She's learning every single day, and I'm learning with her. And I'm going to bring up these little enzymes and these peptides, and we're going to all talk about it. Okay? That's what we do on our consultations. Okay? All right? So you guys, you guys have a great rest of your day. Have a blessed day. Get out in the sun. Walk. Get out in nature. Smell. Hug a tree. Right? Take your dog for a walk. Do all these things. Get rid of fake food. Eat some real stuff. Okay? All right. You guys have a great one.